Our next conversation is about using AI for data in research, and it's a big one because today is Friday. We have Health Friday conversations. This one is a big one. How do we embrace AI technologies in healthcare? We're joined by two gentlemen. Henry Owoko is the Monitoring, Evaluation and Research Officer, and as well as Data Protection Officer with the African Population and Health Research Center. Sam Makau is the Communications Co-Chair at the Coalition for Health Research and Development. Gentlemen, good morning.
Good morning.
Welcome to Kenya's biggest conversation. It's good to have you here. And to welcome you to the conversation, CT has the day's proverb. This week's proverbs are from the country of
Kenya.
Gentlemen,
you may have heard of the country.
Definitely have.
Yes, you have, huh?
Yeah. Accidentally.
Okay. Good fortune doesn't like the roar of a lion. That's what I said. Now, the guests we had a problem with that proverb, so we tried to tweak it. And the tweak was, good fortune doesn't roar like a lion. One was doesn't like the roar, the other one is now like roar like a lion.
Mm-hmm. I prefer the second one.
Me too.
I prefer the edit.
Me too. I think you've heard of pesa imenyamaza, yeah? Money doesn't make noise.
Yeah.
Yeah, it's good fortune. Yeah, no, it doesn't.
Really?
Yeah, small money does. But
in which country?
Big money?
In this country. Have you ever been in traffic and you're telling your that's supposed to be a horn, and you look in the rear view mirror if you're driving, and there's this huge car that has decided that on a single lane they're creating a third lane. Mm-hmm. And if you think it's one car, the other car's following. Have you ever come across that one?
Mm-hmm.
Yeah. And then they have strobe lights like a disco. Okay?
Yeah. Mm.
Now, see, that's money speaking.
Making a lot of noise, no?
Making a hell of a lot of noise.
And being a nuisance.
I'm an absolute nuisance. Mm-hmm. But I get your point.
Yeah.
Eric would have asked you, what do you make of this proverb? The one which you like.
Yeah, I don't know.
You must.
Listeners are such Kenyans. You basically edited a proverb and customized it, made it yours, and you still can't define it.
And he had said he liked it. So what do you like about it, which you now say you don't know?
No. I tend to think that, compared to the first one, this one sounds better. Yeah, this one sounds better. I don't know why. It's just a gut feeling. Okay. Sam, what's your interpretation of either of those two proverbs?
When there is sort of myths that people have when they say that don't tell people when you're planning big things, just keep it to yourself. Let's say, these people are leaving the country and they say, I'll only tell people once the flight is booked, the visa is there, everything is there. It's the same thing. That's good fortune. You don't want to shout because you never know who's watching and is trying to cancel your airplane tickets.
Kamati ya roho chafu.
Iko.
Okay, Sam. You are a communications co-chair at the Coalition for Health Research and Development. What's that?
Yes. So CHReaD, we call it CHReaD. The Coalition for Health Research and Development is a network of non-state actors. These are NGOs that have come together and they've seen a need to advocate for research and development. There are a few issues that need to be addressed within the space, whether it's on policy, ensuring that the policies create an environment that will ensure that in Kenya we have robust R&D, or it's in financing, ensuring that there is enough money being allocated to R&D.
That's it? Huh?
Yeah, that's it.
It's just ensuring that there's enough money going into research and development.
And the policy environment.
Okay.
Yes.
What about the modern technology now being deployed? We've seen AI coming in. We want to have a conversation on AI.
Yeah.
Uh-huh.
So what happens is different partners are working on different things. Different partners normally have different mandates. So you find that within the coalition, we have organizations that are working in HIV, in TB, in malaria. But of course, they have a component of R&D. So they're looking at how do we improve treatment towards HIV? How do we improve treatments towards TB, malaria, non-communicable diseases and also tropical diseases that are found within the country.
Yeah.
So trying to find local solutions to these problems that are uniquely ours. Yeah.
Henry, at the African Population and Health Research Center, we've had the pleasure of hosting the director here, and we had an interesting conversation. You are the officer in charge of monitoring and evaluation and research and also data protection. Now, that aspect of data protection, research is all about data.
Yeah.
It's big that you actually now think about how you protect this data in this new world of technology. So what is it that APHRC is doing?
Yeah, so just to mention a little bit about APHRC. So APHRC is a policy and research-based organization, Africa-based, Africa-led, right? And what we are trying to do as an institution is to make these advances in the field of research. And we have a couple of program areas. One under human development. Here we are looking at education, gender, and so forth. We have one under health and well-being. Here we are exploring and studying the space of nutrition, maternal health, and so forth. And then we have urbanization. Here we are studying migration and the likes. We are looking at sustainability of it. And then we have the elephant in the room, the data science programs. And if you think about research, if you think about artificial intelligence, if you think about all this, it isn't really possible without data, right? But then data, whatever data we are using is actually linked to individuals, right? It is defined. Whatever we are talking about, it's about human beings, right? And so what we are saying is, although we want to make advances in technology, right, we need to make it in a way that we do not harm the people for whom we intend to benefit with it, right? And we've seen previously, historically, and with a lot of ethics studies, you see that researchers human beings can be overbearing sometimes, right? And so, so with data protection, we are trying to set some borderlines and ensure that whatever we are doing is within the ethical standards, within the law, and
Okay. Do you think that even as we have this discussion, that the regular citizen understands research, the role of research, data, the importance of data? Because I asked this question, I could continue, but for something to make sense, I have to understand it. And for me to understand it fully, I need to understand how everything you're saying impacts my life on a daily basis.
Definitely.
So now, please go ahead.
Yeah. So I think at the moment, compared to a couple of years back, I think we have a better understanding of what data is, what our data means.
And we here is who exactly?
Let me say Kenyans, but then there's still a lot to do.
Yes.
So I'm saying we've moved. So let's think of 2015, right? We didn't really care so much about what data is being collected by what institutions. But right now, after Huduma number and the likes, we started caring a little bit. But I think there's still a lot more that needs to be done in this space. We need to break down. You guys are aware we have a Data Protection Act in Kenya, right?
We are aware.
Yes, and we need to break this down. We just don't need to know that, okay, we have a law that regulates this. We need to know the contents of the law. To what extent? How far do we agree with it? How far do we disagree with it? And
Okay.
So there's still a lot to do.
So in terms of the conversation that we're having, we're looking then at AI technologies and how they then can help in improving healthcare. So maybe we can come towards AI and say, all right, AI, artificial intelligence, we know what that is. Maybe what we can do is, can we look at a definition of what AI actually is? Interventions void of human intelligence, but then in order to have that intelligence, there must have been a human behind it to create it. So what exactly are we talking about? And then now going into the realm of how it does affect or how it can improve healthcare and technologies.
Yeah. So you want to go?
I think maybe I can start with some of the myths that currently exist around AI. And I actually wanted to answer his question, the one that you asked him. Two things are being done right now. I know in Kenya right now, the good thing is Kenya is one of those countries that have really strong civil society that collaborate together. And what they're doing is ensuring that there is community engagement. So whenever you are coming up with an intervention, let's say in the realm of HIV, prevention, diagnosis, treatment, and care, they are involved in the process. So you're not coming up with interventions without the people who are actually going to use these interventions. And then the second thing is that there's a study going on right now, and it's looking at citizen science. It's looking at empowering the people to participate in such scientific processes. So looking at who do you engage in such situations? Is it doctors? Is it healthcare workers? Is it people who work within the communities? And you're looking at how they're going to be able to meaningfully contribute and look at scientific processes that lead to the development of AI products and technologies.
That's what they're doing. Why are they doing it?
They're doing it because it's important that the people who use the interventions are able to contribute to how it's being developed. More often than not, you find that people come up with interventions, health interventions, without consulting the people who actually use them. And you need that feedback because at the end of the day, the quality of care is what matters. And quality of care is very personal.
So are they suggesting that this hasn't been done before?
No, it's not that it hasn't been done before. It's that we are in the age of technology. We're in the age of AI, and it's not. It was done before, but fragmented. Now you find that partners are coming together and they are working together to do this. That's why you have a coalition like CHReaD that is coordinating over 20 different civil society partners and NGOs to contribute to different parts of this R&D work.
Okay.
I want to ask about that artificial intelligence, right? It's basically machines looking at what people have been doing and then using that and learning a bit more. If we use it in health research, what kind of risks are we talking about? At what levels do we actually engage AI in health research? And you were coming actually to answer that, right?
Yeah.
Yeah. Get in there.
The different levels that you can use AI. But mostly, I think the most useful use of AI, especially within the health sector, is in processing data. Because there's a lot of health data that is out there that is fragmented, that you need to put together, you need to analyze, so that you can be able to have, you can be able to draw out conclusions or different things from the data. So AI will help people process the data much better, much faster, and more accurate. And I think for me, what I'd say is when I first heard of AI and its intersection with R&D, I was thinking around diagnosis. There's so many cases of misdiagnosis around the country, and it's not just in Kenya. It's not just a Kenyan thing. It's a global thing. I am myself a victim of misdiagnosis. I know a couple of people who've been misdiagnosed, so it can really come in to help some of these issues. And we have a lot of issues with doctors and people who work in the healthcare, especially when it comes to them being paid and other things. This would be a tool that would be able to enhance the treatment of care when it comes to now doctors interacting with patients and being able to provide better care.
And allow me to jump in with an example of one of the work that we are currently doing. So right now we are working on what we would like to call Inspire Pitch. This is a platform funded by CHReaD and IDRC.
Inspire Pitch.
Yeah, Inspire Pitch. So the Inspire part stands for Implementation Network for Sharing Data from Research Institutions, and then Pitch is a platform for evaluating, analyzing harmonized COVID-19 data, right? And so what we are trying to do with this is we are picking data from different sources, COVID-19 data from different sources. This can be from health facilities, this can be from what was collected by government and so forth, right? And so if we are pulling all this together, harmonizing it, putting it, if you pick data from different sources, they exist in kind of different ways. Someone has defined age a little differently from how you've done that. And so there's a little of harmonization that that goes on there. And you see, when you're picking it from different sources, this becomes very large data sets.
Bulky.
Very, very bulky stuff, right? And so there's a harmonization process that goes in, a very painful process that it requires a lot of hours of work put in there. And then this data now is put through a platform that now can display finding. It processes the data in a little one more step beyond what we would have easily seen, right? And so what do we benefit with this? So if you think about COVID, one of the challenges was on response time, right?
Yeah.
So we know COVID is already going, the infection is already spreading. In fact, even before we knew the infection was spreading, it took quite some time, right? And then we knew it was spreading, but then we had to collect data and see how it's spreading, right? But then that's because mostly we were relying on the traditional analytical approaches, right?
Right.
But now with machine learning, we feed data, we harmonize this data, we feed it into the machine, and then we are able to draw lessons in split seconds. And our response time then reduces. It enables us, so in the sense of COVID then, we
can react much faster.
We can react much faster and prevent the spread, and will have prevented the spread a little.
But do we trust this machine not to make mistakes?
So, while we're talking about artificial intelligence, let's think of what goes back in the back. So for this machine to make decisions, it's looking at data.
Yes.
It's trained on data sets. And so I'll tell you, for before this machine makes a mistake, then a human being has probably done a mistake somewhere.
Exactly.
Yeah.
Yeah.
So even as it makes decisions based on the data, there's always someone else who's going to look at the data and do some data cleaning at the back.
Which is why I was asking in the initial, can we define what lines are we talking about when we're talking about artificial intelligence here? Because if we say that a machine is making decisions, or a machine essentially is informing decisions, somebody gave the command. Somebody created the footprint upon which this machine was going to walk, isn't it?
Yes.
Right? And then somebody continues to monitor and make sure, essentially, that this machine continues to do the right thing.
Yeah.
So can we then say that artificial intelligence really then is void of human intelligence?
I have to be very careful when responding to that. Right now, the technologies as APHRC, whatever we are interacting with, is dependent on data that is fed. But we know out there is potential for artificial intelligence that can solve problems that it has never been trained on, right? That is a potential space. And there's a lot that's going down in terms of managing that and seeing how that is rolled out. But right now what we are speaking about is on artificial intelligence that's dependent on data that is being fed.
Okay.
It's like looking at a kid,
Yes.
right? A child, a baby, will learn from the parents and the people around it. And then by and by, this child then becomes intelligent and they start making their own decisions. So by and by, this machine that we are feeding initial data and all will get to a point where it's intelligent enough, like you said, it's already happening, where it starts making decisions on things it has never encountered before. It's seeing it for the first time, but using history, using analytics, using everything else that it knows, then it can see, this is how I probably solve this problem. Health, Buana.
Yes.
Isn't this dangerous? That at some point we shall actually rely on a machine to make health decisions.
But we actually do, even now.
It doesn't worry me a lot because throughout this process, there's someone always looking at the data.
Okay.
There's always that second human eye that's looking at and saying, okay, these were the decisions that were made here. These ones are questionable. Why? And then you look at data. Let me give you an example. Say you train a machine on skin cancer, a disease that's prominent among, say, Caucasians, right? But then you find someone of a different race suffering from the same disease. This machine is likely to make decisions based on the data set that it has been fed. And so what it comes back to us human.
Okay.
That if we want it to make decisions that are more inclusive, then we feed it more inclusive data.
You know, you've jumped right into it.
Yeah.
Because when the human beings who are involved in this research conduct this research, you're talking about inclusivity. It's a discussion, yes, but when you have equipment, whether it's AI, when you talk technology, the testing tends to be in the countries where this technology is manufactured. And the people who test these things are people from those countries. Now, inclusivity is supposed to inform us that other people who don't necessarily come from those countries, share traits, share likes, are included. That's what the discussion of inclusivity. But as we speak now, how much of that inclusivity actually exists in what we have and what we work with? Because if you're talking research and data collected, which has informed the formation and the creation, the development of these things, if it doesn't start with the diversity that you're referring to as inclusivity, then already Eric's question now comes into being. Meaning, how do we know that just because it worked here, it will work in the same way here, given our diversity and our differences?
Exactly. And that's a more, let me say, a more political question than it is AI. And I'll tell you why. That if you think about agrarian revolution, industrial revolution, as Africans, we came into the playing field late. But then here we have an opportunity.
We did.
Yes, we did.
We
Sure, we
started
did.
this
thing.
With industrial revolution, things happened out there,
industrial,
and then
okay.
it came to us, right? But then right now, artificial intelligence, machine learning is at when it's getting founded, right? And we have that opportunity of being players in it. As APHRC, I think we are working with a couple of partners, and honestly, I have to mention CHReaD and IDRC once again, and thank them for the kind of support that they are giving African institutions to make advancement in this space.
Okay.
And we cannot wait and say that we are going to wait for the technology to be developed out there and then consume it. We no longer want to be consumers.
But we're not saying we wait. I am referring to the reality. The technology already exists. We were not included in it. Just reality and fact. Not that it is bad, but you see the question Eric raised shines a spotlight on, yes, it is good. We've seen it work, but what about when it comes to people who don't represent the group on which these things were tested? That's all we're saying. We're not saying it is bad. We're not even saying it doesn't work.
The reality is there's a level of bias when it comes to everything that we do. So even when we are putting data together, there will be a level of bias. Even I'm sure you've heard of doctors in for example in the US now coming up with models that specifically address issues that are that Africans are facing, because there was bias when it came to development of treatments from the different races, if I can say that. So it is important that as we continue to develop these tools, as we continue to develop these technologies, that we address the bias that is there. And we have researchers that are actually looking at addressing the bias within the health sector and using AI, or rather ensuring that the bias is factored in the AI, so that when the data is being processed and you're looking at your output, it has that in mind.
So when it's coming to this market, it's coming empty-headed, so to speak. That will now put the
Blank
brain
canvas.
Let me mention something.
will put
AI
the data into its brain.
AI is not a single technology, and there are advancements. So I'll tell you, we are talking about Inspire Pitch. Someone else is talking about ChatGPT. Everyone's heard of this.
Yep.
Someone else is talking about no-code platform. Someone else is talking about this and that, right? And so there's what has already been developed out there, but then there's still a lot out here that can be done.
Yeah.
And so are we going to sit and wait for everything to be developed out there?
Okay, that's the challenge.
Yes.
We're having a Health Friday conversation, embracing artificial intelligence technology in health research. We've got two people with us in the studio. Henry Owoko is a monitoring, evaluation and research officer, as well as a data protection officer with the Africa Population and Health Research Center. Sam Makau is a communications co-chair with the Coalition for Health Research and Development. You are explaining the I mean, you're saying we cannot just sit back and be left behind. We've got to participate in this. We've got to get our hands into use of this advanced technology and how it's going to do. I want to just go back to that question. What are the risks? It's okay. It has its own benefits. What are the risks that you've identified so far? Are there any?
Yeah. So, and I'll take you back to some of the myths, some of the fears that people have. We've always feared that artificial intelligence is going to take our jobs. We've always feared that AI is going to take over the world. But far from that, the truth is this: unlike in any field, the need for regulation, the need for consistent monitoring, right? And if we consider bringing in both technologists and policymakers and civil societies together, whatever our fears are, I think aren't likely and are less likely to even occur.
Okay.
So, yeah.
Has there been or is there current engagement between the civil society groups that you've spoken about who are directly involved in these processes for education and awareness to the general public? Because we must understand some of the points that you talked about. We're looking at still probably a very traditional way of things like diagnostics. You go in, take your temperature, check your blood pressure, because AI, we know, is also playing in the field of diagnostics. We know this. But you're also dealing with the people who have leaned heavily on the traditional. So what is happening now to educate a society whereby unbelievable results can be gotten by inputting data into a machine, and somebody says, come and we'll tell you, and I may not even need to touch you to figure out what's going on? What kind of engagement is going on to make sure that people are getting an understanding of this?
I'd go back to the point of this is an emerging field, especially within the African continent. Unfortunately, AI has not picked as well as it has picked in the West. So what we are trying to do now is, in fact, just capacity building other organizations to understand it. Because to be very honest, you'll find that a lot of partners will understand research and development, but will not understand AI and its use and how it comes into the picture. So there's the issue of capacity strengthening the people who actually should be talking about it, so that now they can go into the communities. So as we continue, as we are doing research on how to engage people, we're engaging the organizations that we work with, our partners, and we're ensuring that they also understand what is their role within enhancing the development of AI and in the use of AI in Kenya.
Okay. Also talking about the risks, and I think that's one thing that we have to still look at it.
Constant thing.
It's a constant thing.
People's minds.
In educating then also about the risks, whether they be minimal, ignorable, or whether they be big and cannot ignore. Is there enough in terms of engagement, in terms of what is actually going on for that kind of knowledge and information sharing?
Yeah. So, and I have to admit, human beings, we have to fear what we don't understand, and the only way to beat the fear is to understand it, right? And so, what we are trying to do, even with this platform, is to create this awareness that this is what the technologies can do. This is how the technologies work, and I think when we understand that these technologies totally depend on, garbage in, garbage out, and it totally and they mostly depend on what they are fed. And so if we fed it data that is skewed, we are gonna get skewed decisions. We're gonna get skewed results. But let's not be afraid of that, because even as they give results at the moment, there is still a second human eye looking at what results has been put out there.
Can I take us back just a little bit, and maybe we can just do again an example of how, for example, in diagnostics, AI is actually working to get an answer that you are looking for. So what would happen? I mean, put us in a clinic, for example, and say, how is this technology being applied that can then give you an answer in medical research, for example? How does this play out?
Okay, so so the Inspire Pitch platform is an example of how it applies, but then in terms of population health, right?
Mm-hmm.
But then there are other platforms you've tried.
What is population health?
So population health is general public health. Let me put it that way. Okay. Yeah. So the issues on pandemic and epidemics when you're thinking about that.
Okay.
Yeah. But then you've interacted with online platforms where you feed in your symptoms and then you get a diagnosis,
Yes.
right?
Mm-hmm.
And then you get so what they're trying to avoid mostly is prescriptions. But I bet in the future we'll get there. You always have to go to a doctor to get a prescription. And this is a really simple example of what is already going out there. These things exist. There is, I've forgotten the name of the app, but then there's an app on period tracking. So women can be able to track their periods.
It's called Flow.
Yeah. Using a mobile application.
Yes.
And this is actually a simple example of what artificial intelligence can do. Yeah. And so,
But is that AI or is that just a simple app that has a simple code?
Yes.
so
For this, and then it has asked you how many days
Then
is
you
your
say,
normal
and then-
cycle, and start the beginning and it'll tell you the next one is then.
It's coming the next, and you'll feel this or this at a certain point. Okay.
and that's the point. People
Where is
think
the AI coming in?
People think that
How is it
AI
learning?
is this wild animal that's coming from nowhere.
Is it not?
That is where it starts.
Okay.
That is where it starts. It's a combination, and so if you think about data that's now available to the world in big volumes, and then if you think about the analytical capacity of machines, and if you put this together, now you get artificial intelligence. Only that when we are talking about the mobile app, you're thinking about it small scale.
Yeah.
A very small analytical capacity with very small data.
Okay, so what
But then
can
when you
it do?
scale it up-
Okay, so let's scale it up and give an example, because sometimes you need to imagine what something could do, and maybe you get a little bit more understanding about it, right? So scale it up. What could happen? What could AI do that could be a medical solution for some of the things that we are looking at today?
Okay, now let me give you an example of what. So right now, when we go to the doctor, we are going for treatment. We normally go for treatment, right?
Yep.
But then think about a world where we can link our day-to-day information, our day-to-day data, with our health facility data, right? And so, if you have a system that can know, like, you take pizza every day a week, and you take at least a bottle of beer every day a week, then this system, and then it knows what you're predisposed to initially, given your hospital visits. This system should be able to, instead of waiting for you to get ill and go for treatment, it should be able to give you a prevention, to suggest
So you should
prevention
raise the red
measures for you.
flags.
So-
Because of your lifestyle
Yeah.
and the way you're going, you're actually just check your sugar levels today.
Yeah.
please,
Yeah.
It's likely to get here.
Yeah, it should tell you should start jogging or something like that.
Okay.
Yeah.
Okay, so like today, there's some folks who, you have a smartwatch, right?
Yeah.
If you've sat for a while, it's gonna buzz on your wrist and
Yes.
tell you,
Get up and
get up
walk.
and walk.
Keep moving.
Or it's gonna tell you it's time to drink some water. Are those along the lines that we're talking about now?
Those are along the lines of artificial intelligence.
Okay.
And now we have hardware, we have software, and then we have the data that's collected on a daily from how he behaves, how long he sits down,
Yeah.
how long he walks. Yeah.
You know, I was now looking at it from the other level of research, where let's say this machine has access to information, to general health information. Let's say the National Health Information System. So you, as a resident of a certain area, then you go to a doctor, and the doctor basically keys in everything that you're saying. These are my symptoms, this and the other. And then this AI platform is able to look at what other people have reported over the last couple of days with either this physician or other physicians, and it can start raising the flags that we are seeing more and more people in this particular region presenting themselves to a health facility with this symptom. It could be an indicator of one thing or the other. Is at the level now that we could get into with research, and how would this help
Yeah. Now you're coming to the space of our pitch platform. And now with that, say you have this data, and you can easily see that people are presenting with flu-like symptoms, and these are kind of the prescriptions that are happening, and you know the general population where these people are coming from. Say it's mostly Nairobi. Then with that information, we are able to design interventions. We are able to come up with policy measures and say, okay, now we have this is an outbreak already. Just looking at the numbers, you see this is likely going to be an outbreak. If in a single day we've seen 100 people, and then we are able to respond in record time. We don't have to wait months after the spread, and then after 3 months of it spreading, that's when we realize and say, oh, this thing has been spreading. No, we just need, say within a day or in a couple of weeks, we are able to see, okay, this is turning out to be a pandemic or an epidemic. And now what do? We start coming out with interventions. We start coming up with the policy measures. And now that's now the real potential of AI in the health space, reducing the response time, but also increasing accuracy in decision making.
This discussion that we are having and everything around it, with the bodies that the two of you gentlemen represent, is this discussion and the initiatives and the research process that go with it, is it driven by the local research entities? And if they have partners and people who are assisting, who are they? And what is the agenda? What is the end goal? We are doing all these things. So where are we headed, and what do we hope to see?
If I can go first. So what we are looking at is having an end-to-end pandemic scheme, and I'm happy with where the conversation is going, because when civil society sat down, and this is the global south, so you find that these are countries that traditionally are not part of development of such technologies. So the global south, this includes a lot of African countries. So they're coming together and they're saying that they want to develop an end-to-end pandemic scheme that will be able to monitor the environment and also prepare for any pandemic. And when there's no pandemic, then the systems are able to prepare for a pandemic, because I think you've been hearing this a lot, especially from health experts. They're not saying if we are going to have a pandemic, it's only a matter of when we are going to have the next pandemic. So we are trying to see how can we be best prepared, and how can our health systems be best prepared to be able to handle such pandemics and epidemics.
Yeah, definitely.
Okay, I've heard what you've said. Have you answered my question?
Come again with your question.
Ask again.
No, I pick your question on the role of funding institutions and their motivations,
yes, I'm asking
right?
If it is led from the south.
Yes, that is the question I'm asking.
Yes,
Yeah.
yes, it is.
So-
it is led by.
Is it really? Are we funding it?
Let me reintroduce APHRC to you, sir. APHRC is an African-based, African-led
African-funded?
research institution.
African-funded?
And I'll tell you one thing that one thing about funding is you have to understand the base of it all, right? It doesn't matter who's funding it.
Oh yeah, it
And
does. It does.
I'll tell you why it
Because
doesn't
whoever's
matter.
funding
What
it
matters is
will have a say in. Funding is not bad. Let me start
exactly.
from
That's
there.
what I'm saying.
There's nothing wrong with funding.
There we agree.
And I am merely asking to understand the juggling and the negotiation that has to take place. Okay? If we are funding it, we will control the narrative. If we have partners, we have to include their narrative and what they want. This is really what I'm saying.
Yeah.
And I'm not casting judgment and saying it is a bad thing. I'm saying, in the spirit of understanding, since we're discussing research, then we have to say exactly where we are so that we know how this thing is going to move along.
Yeah, and that's why I say, APHRC, we pride ourselves in engaging with other institutions that have our shared vision, right? And so with that at heart, whatever funding we are getting to drive the space of AI or any other space in research and development has the African interest at heart.
You know my problem with this? Let me explain to you my problem. If our governments do not participate fully or they are the bigger brother in this, then it means they also don't understand, or they haven't been gotten to understand the benefits and why it is their involvement should be greater. The countries and the partners we deal with already understand this.
Yes.
That's why for them it's, as you say, it's a no-brainer. But for our government, if that is a no-brainer, then this one is a full-brainer, because it's clear they haven't quite gotten it. So the discussion now is, how do we get them to on board so that they also get it and understand?
Yeah.
Because we're talking about things that are going to benefit these poor downtrodden Africans.
Yes.
Okay.
Now, and for sure, we've had quite some support from the Ministry of Health in Kenya, especially with discussions around data, availability of data and access to data, right?
Yes.
But then it takes time. And we understand how government works. It has to be at the core of
I
the...
really do not want to take that route. We cannot excuse whether it's a ministry or government by simply accepting that, that is how they work.
No.
We're talking about human lives and how to ensure that we prevent any harm that may come to them. And the way government works, we understand and know the discussion ought to be, how do we ensure it works better?
Yes, exactly. And at this point, I'll tell you the amount of support and engagements that we've received with the Ministry of Health within projects that are artificial intelligence related, but also outside of those projects. I think it's overwhelming, and it only demonstrates the interest of the government in being part of this.
In discussions, how much money have they put in? Okay.
I cannot comment on that. I do not have any information on that. So, yeah.
Would it demonstrate a desire as well to have more of this technology at hand to be able to diagnose, to be able to prevent, to be able to offer care and treatment within the healthcare? Because if there's an acceptance of these things, then there's probably a show for the desire to make sure some of these things then are covered when it comes to those parameters within healthcare.
Definitely, I think funding demonstrates a desire towards that, and I totally agree with you. It's something that it will really be awesome if we say significant funding of research in artificial intelligence and machine learning comes from African governments, right?
Have you seen how quickly the government buys cars? It means they think it is useful. Do you see how quickly it is that MPs clamor for their salary and we have a budget-making parliament? It means they know it's important. I'm simply arguing and saying that when people say they are serious about something, they put money into it. And I think I've said what I want to say on that particular subject.
I actually have to agree with you on that point, both of you. The first point is that the government, we work very closely with the government when it comes to doing advocacy around R&D. As a coalition, we've worked very closely with the ministry. But I have to agree with you when we say that when you find something valuable, you need to put your money where your mouth is. So it's true. We do work closely with the government to advocate for more resources towards research and development, but that's not the only issue that we're advocating for. We're also talking about ring-fencing this money to ensure that it actually goes to R&D, because if you look at the budget, there is money that is allocated to R&D.
Right.
How much is it? What percentage is it of our GDP?
I will confirm that, but I know
it keeps reducing. It started at 2%. It's a fraction of 2% now. So does that indicate seriousness to you?
Yeah, when it comes to financing in the health sector,
Sam is about to say,
it's a very sensitive topic. It's a very sensitive topic. But we are looking at, for the funds that are currently here, can we ensure that it is working before we start advocating for more money?
So it's the kind of thing like to whom, if you're given a little and you can be entrusted with that to make sure that this thing actually makes sense, then in the time whereby maybe the seriousness matches the amounts of funding, then you can say, look, we've already proven where this has taken us from.
Yes.
We've already shown what it can do, and because of that we can now get to a place whereby it's untold the kinds of things that you can do, again, for those issues of prevention and care, treatment, information and knowledge and understanding.
Yeah. And as advocates, it is our responsibility to create that appetite, because the government will do what the government does. It is an unliving entity. It will just operate the way it operates. It is our job as advocates to show the need and the importance of having R&D and what it does to communities. Then the government will see the need of putting more money into R&D and also ensuring that the money actually goes to R&D and not to other things.
Yeah, and like I mentioned at the start, that you'll think AI has these two important components: the analytical capacity and the data. And if you imagine the amount of data that we generate as a population at the time, it's mostly because the government has made it possible. If you think previously, there was quite some information, but very little digitized, and even amongst the ones that have not been digitized, there was still like very little. But then if you think at the moment, there's a lot of information out there, mostly enabled by the government. If you could go to KNBS and you'll get a lot of statistics that could help you develop systems that could make health decisions for the better of the population. And so while the funding is important, really, really necessary, really, really urgent, there's also the other bit, not the hard cash that's coming in, but the contribution towards with the enabling data availability and so forth. So
that's already a big thing.
Yeah, that's equally a big thing.
You know, the government just recently ratified APHRC, which ensures that we create a conducive environment for pharmaceutical manufacturing within the country. That is a step. It might not be direct contribution of funds into R&D, but that is a step that ensures that the environment is friendlier to such responses and interventions in health.
So it allows this to happen.
Yeah.
Is Inspire Pitch, in just about 30 seconds as we conclude, Inspire Pitch is already rolled out. It's operational.
Yes.
Right?
Yeah.
It's operational. It's being used by APHRC in health research in Africa.
Yeah.
In Kenya as well. Okay. It was good to just get that out there.
Yeah.
Henry, thank you very much for joining us. Henry Owoko is the Monitoring, Evaluation and Research Officer and also Data Protection Officer with the African Population and Health Research Center. Sam Makau is a Communications Co-Chair with the Coalition for Health Research and Development. We've been talking about artificial intelligence technology and how this can be used and accelerated for use in research, in health research across the African continent.
This is the Situation Room, the only way to start your day.